name is Jasmine. I'm an acupuncturist and a traditional Chinese medicine practitioner. I'm here to tell you today about the answers to the most commonly asked question is, what is acupuncture? What does it feel like? And does it hurt? So acupuncture itself is about 5,000 years old. It's extremely old. It's been practiced for a very long time and has been spread across many, many cultures. It started off in the Chinese culture, but has actually has been practiced for many years in a lot of countries. Acupuncture is simply just one modality of many modalities that's based in traditional Chinese medicine. So acupuncture itself is the insertion of hair-fine needles, tiny, tiny little guys that's inserted under the skin into the muscles to actually create change. So traditional Chinese medicine and acupuncture believes that if there's a health symptom, something that you're battling, something that's not optimal for your health, it's as a result of an imbalance or not enough nutrients, blood or qi that's flowing through meridians or energy pathways that run head to toe throughout our body. So when these meridians are flowing optimally, we are in our best health. So what acupuncture does is we actually place these needles in specific points to ensure that there's enough nutrients, there's enough blood, there's enough qi, also referred to as energy, flowing through these pathways. So the needles itself, different practitioners will have different brands and different types of needles. I don't know if you can see those little guys. And in this little pack, there's about 10 in here. They're individually packed usually. They're sterile. They're one-time use, never to be reused, disposed of properly in a biohazard container. So what will happen is that your practitioner will open up one of these packages. There's, again, based on the practitioner, they'll insert needles differently. A lot of the practitioners will use a guiding tube, so this little tiny little tube, which will pick up a needle, and it's usually placed in there. So what the little needle looks like is this little tiny, tiny little needle. It's hair fine, extremely thin, solid, and it's basically made out of stainless steel. I think what most people fear of needles is based on our experience of what needles have been, is basically having our blood drawn. And those particular needles are larger, they're hollow, and they hurt a lot more than our acupuncture needles, which are hair fine and tiny little guys. So what to expect is basically practitioner will clean off your skin, right? We'll clean off the skin as to where the insertion is. We'll grab one of these needles, either with a guiding tube or on its own, and basically you're relaxed. You're either seated in a chair or reclinable chair, lying down in a bed, and these needles are actually just basically placed in, often just tapped in with a solid tap once the tube is down. Tube is removed, and the needle is actually placed further into the muscle. That didn't feel like anything at all to me. The tap itself can feel, for some, like a mosquito bite, and for others, most people are quite surprised at how very little they do feel, because the needle is so tiny and is sharper than the hypodermic needles, and so therefore you don't feel anything on the surface. Once you place it deeper into the muscle, patients are advised not to move, because if you move, it moves the muscle and therefore moves the needle and can cause pain. But outside of that, the needle itself is really tiny, really little, and is really comfortable in terms of the insertion. Needles often, for most practitioners, will be retained, meaning patients will lie down with these needles in their bodies, in their muscles, for anywhere from 15 to about 25-30 minutes. You're usually comfortable either covered up with a sheet or have a warming lamp or a heating lamp placed over top of you so that you're really warm and nice. Most patients will fall asleep, so it's a really, really comfortable treatment to do.